I'm at the offices of the Dermatology Laser and Vein Specialist of the Carolinas, where you will find total rejuvenation in their newly remodeled 12,000 square foot center. Dr. Muna Bali has performed rejuvenation procedures on political figures, on professional athletes, and on actors in his career in California, in Maryland, and now in the Tar Heel State. So let's go inside. I want you all to meet Dr. Muna Bali, who is very special to me for whatever reason that women get varicose veins. I had them. They were painful, they were embarrassing, and this is the doctor who helped me with the problem. Dr. Gilley, thank you very much.
Thank you, Barbara.
You know, I went to 4 doctors, and you were the first one that diagnosed the problem. Tell everybody about that.
You'd been to several doctors, and it was pretty obvious to me that they had not researched the underlying issue. And when I looked at your legs, it was more so looking past the spider veins that we all have into what was really causing you to have aching and throbbing, and that was what we referred to as saphenous reflux. And once we identified that problem and diagnosed it in the office, we were able to use a brand new technique called the CTEV endovenous closure to go in there and really non-invasively seal it up, and I thought your legs got better within several weeks.
It worked wonderfully.
Thank
no
you.
more embarrassment and no more pain and no more discomfort. You actually developed the CTEV, am I right?
Yeah, I was really fortunate to work with some of the leading minds in lasers and phlebology and really expand that procedure to what it is today. It really is a remarkably non-invasive procedure, and I think the success rates we were getting in the trials were upwards of 95% after 2 years, so it was really a successful technique.
Many patients ask, why do I have varicose or spider veins? The causes include a family tendency. Hormonal influences such as estrogen and progesterone make blood vessels soft and expandable. Pregnancy puts a lot of pressure on the veins of the leg. Working for long hours while standing and growing older makes veins more stretchable and leaky. Normal venous blood flow out of the leg is from the calf muscle. Blood cells are pumped back to the heart like squeezing a toothpaste tube. This exhaust flow stops at rest, then gravity pulls blood backwards down the leg. Normally, valves stop this reverse flow, but when the vein is overly stretched, the valves don't close. Blood rushes down the leg in the wrong direction, further expanding veins below the abnormal leaky valve. Valve leaflets can either stretch or become damaged. This process spreads from one valve to the next, causing varicose and spider veins to form in this exhaust system. The outpatient methods used to treat veins include sclerotherapy, the method that uses injections into the veins, ambulatory phlebectomy, an improved surgical method in which veins are removed by tiny punctures, endovenous laser ablation, the newest and least invasive method, uses laser to close the vein affected by venous reflux. The body naturally reroutes the blood to other healthier veins, eliminating the symptoms. Sclerotherapy, the most commonly used method, can be used for removal of spider and varicose veins. A solution is injected into the veins to cause them to swell shut and slowly be absorbed by the body over weeks to months. The procedure of sclerotherapy involves using a hair-thin needle which is gently inserted into the vein. A small amount of a solution called a sclerosing agent is gently injected. Very minimal pain is experienced. A series of treatments are usually necessary to achieve the desired results. The injection method is shown here. The vessels appear to vanish with each injection just like magic. However, it will actually take several months for these spider veins to disappear as the body slowly reabsorbs them. Ambulatory phlebectomy is the modern, minor surgical method to remove larger varicose and blue veins. It is a relatively simple in-office procedure, which is performed with local anesthesia only. The patient is usually not sedated. Tiny puncture sites make ugly, large scars a thing of the past. Here is a brief example of removing a vein through a pinpoint incision. This modern surgery is very different from the vein surgery of the past. The end result of this puncture and hooking technique is that the targeted veins are actually removed, so that only one treatment is required. For longer sections of varicose veins, a separate session may be required. The tiny puncture marks slowly disappear and are usually gone within 3 to 6 months. The large varicose vein clusters seen here on the lower legs are completely gone after one treatment. A few small puncture marks remain at 1 month post-mini surgery. These veins should not return.
For the endovenous laser ablation technique, a small catheter is used to gain entry into the vein. Small needle punctures guided by ultrasound under local tumescent anesthesia ensure a pain-free treatment. Laser energy is applied as the fiber is slowly withdrawn by heating up the vein wall. The vein wall shrinks and collapses as the fiber is pulled back. The closed vein is slowly absorbed over months. This less invasive procedure is a substitute for stripping of the saphenous vein. Shown here under ultrasound is the shrinking of the vein. The large dark space of a varicose vein shrivels with this technique.
Before any treatment method can be planned, you must first consult with the doctor. This will allow your doctor to examine your veins. It is best to bring a pair of shorts along for the visit. Your doctor will decide whether you need any further testing. You will most likely be measured for modern, lightweight support hose, an essential part of any treatment for abnormal veins. A test injection or test of the laser may also be performed at the first visit.
A non-invasive painless test called duplex ultrasound will be done, which is comparable to an echocardiogram. This duplex ultrasound is typically covered by most insurance plans, but only performed when medically necessary.
The duplex ultrasound test is often necessary for larger or hidden veins. This device uses sophisticated computer technology and sound waves to construct an image of your veins which can be viewed on a screen. Hidden leaks can be uncovered. A needle may be guided directly to a leak point during an injection. Blood can be seen flowing in the duplex ultrasound screen, and the leaky valves in varicose veins can be heard. The risks of ambulatory phlebectomy include bruising, bleeding, rare allergy to local anesthesia, tenderness along the removed vein, rarely infection, rare swelling, and a temporary numbness.
Risk of laser ablation can include bruising, mild post-treatment pain, and possible reoccurrence in several months to years. Laser is 95% successful. However, other risks include bruising, heat sensation during the procedure, and small areas of numbness lasting up to 6 months or less.
The injection technique or sclerotherapy also has a number of risks. These include skin darkening in the outline of the treated vein. A prolonged blush or what is called matting may also occur. Bruising, particularly for a few days after. A knotty feeling, particularly in larger veins. An allergic reaction to the sclerosing solution, and extremely rarely skin breakdown or ulceration. Rarely superficial venitis or phlebitis, different than deep venous thrombosis, can develop. Skin darkening, called hyperpigmentation, refers to brown spots that look like bruises caused by the iron in red blood cells left behind after treatment. Occurring in approximately 1 out of 10 patients, this brown staining may also follow the path of the treated vein. Brown spots may take weeks or even months to disappear. They are minimized by wearing support hose after the treatment. In this severe case, the brown outline of the veins is visible after treatment. The vein is completely treated and will disappear on its own in another 2 months. Another common side effect is the blush or matting. A red blush comes from enlargement of tiny capillaries irritated during the injection process. This usually takes weeks to months to spontaneously clear. Occasionally, further treatment is necessary to improve the blush. Here is an example of a blush that disappeared on its own without any further treatment. Accumulations of blood in larger treated veins may lead to a feeling of knots. This lumpy feeling is temporary and caused by trapped blood, like a bruise within the vein. Sometimes a visit to the office to remove this bruise-like accumulation will instantly reduce discomfort. Larger treated veins have greater space within them to accumulate blood. As with the other possible side effects, use of support hose minimizes these possibilities. This is a knotty vein which turned brown following treatment. This disappeared spontaneously in 2 months. Good methods of pressure or compression over the treated veins reduces the incidence of this side effect. A rare side effect of the injection method is skin breakdown or ulceration. Rarely blistering, ulceration, infection, and scarring may develop at the injection site. This occurs when a person is extremely sensitive to the tiny amount of solution that may leak out into the skin during the injection process. It occurs in far less than 1% of patients. This is an example of a small ulceration which healed without scarring. Superficial phlebitis, not a dangerous condition, may occur from the bruise that accumulates within the vein after treatment. It is usually limited to the site of treatment and rarely progresses to form a real clot. The incidence is extremely low. This condition is very different from deep thrombophlebitis. This shows the rare spot where redness and tenderness occurs following injection of a large vein. This disappeared quickly. Does treatment limit your activity in any way? Most patients may resume normal activity immediately. In fact, walking is important right after treatment. Support hose must typically be worn for 1 to 2 weeks. Heavy weightlifting with the legs should be avoided for several days after treatment. Hot baths and showers should also be minimized for several days.